Hello guys, so today we shall be discussing regarding the migraine, and migraine is one of the worst kind of headache, and more worse than that we have got some more hemorrhages within the brain, which are called as the thunderclap hemorrhages, or whenever there is a burst of aneurysm. So those headaches are very severe. But when it comes to the over here, migraine itself is a very, we shall completely discuss with concepts what exactly is migraine, what is happening over here, and at the end we shall also discuss the treatment plan. Okay, so first of all, the most important thing over here is your migraine. So this is the picture of migraine over here. So what is exactly happening in migraine? What is exactly happening in migraine? What is exactly happening in migraine is that this migraine is involving the neurovascular bundle. Okay, so important thing is that this is a primary neurovascular headache. Now why am I stressing on this word neurovascular is there is another type of headache called as a tension type headache. I will tell you the differences. So in the tension type headache, you won't have any kind of neurovascular involvement, but here in migraine, primarily the involvement is neurovascular. The nerves and the blood vessels, both of them are involved over here. Okay, so this is a primary neurovascular headache. And again, I'm telling you, neurovascular in the sense nerves as well as blood vessels, both of them are involved over here. Usually, we get headache when the blood vessel dilates, and in migraine, that is the thing that is happening. The blood vessels get dilated, and that is the reason why there is headache. And there are also other substances that are released. We'll discuss that in a minute. So if you go to the pathophysiology, like what exactly happens? What exactly happens within this migraine? What is the pathophysiology behind this migraine? That is one very important thing which you need to know. So what is exactly happening is that the first important point is there is cortical spreading depression. There is cortical spreading depression. Now, when I tell this word cortical spreading depression, what do I exactly mean? What do I exactly mean is that, guys, all of you just look here. In this cortical spreading depression, there is some abnormal wave that is generated within your brain. Okay, so let me take this part. This is your brain, right? Within this brain, right, this is your frontal part, this is your occipital part. Within this brain, there is some abnormal wave that is generated. What is this abnormal wave? So what is this abnormal wave is that actually this abnormal wave starts at one point of the cortex. It starts at one point of the cortex and spreads all the way to the brain. So what is exactly happening over here is that first there is increased electrical activity within the brain. Again there is decreased electrical activity. Again there is increased electrical activity. Again there is decreased electrical activity. So in this way a wave is formed, and this wave starts at one point. Anywhere it can be. Let's say it starts in the frontal lobe, and this wave with increased and decreased electrical activity, it passes all over your brain. Okay, so this is what is exactly happening, and this phenomena is called as cortical spreading depression. Okay, this particular phenomena is called as cortical spreading depression. I will write down all those things. Okay, so just look whatever I'm writing down over here. So what is cortical spreading depression is that there is an abnormal wave, or brain activity that is generated. Okay, so this brain activity, it starts in one area of brain, one area of cortex, and then it spreads. It starts in one area of the cortex and then it slowly spreads. So what is happening is that first you have got increased electrical activity. First you have got increased electrical activity, followed by there is decreased electrical activity. Okay, so there is increase, decrease, increase, decrease. So in this way there is an abnormal waveform. Now very, very, very important. I